National Cabinet has agreed to new vaccination targets to ease restrictions and reopen Australia. Under the four-phase plan, lockdowns will become less likely and international borders will gradually reopen. The next stage will be triggered when 70% of the population is vaccinated.
These are targets for all Australians to achieve. States, territories working together, communities working together, individuals, GPs, pharmacists. Australia will get this done by working together. The targets are there for us all to achieve and for us all to work towards.
Let's go through each stage. Australia is currently under the first stage, suppressing the virus while the vaccine rollout continues. State and territories agreed to implement tough restrictions, such as lockdowns early, to fight the Delta outbreak. The country will enter Phase B, the next stage, when an average of 70% of eligible people are vaccinated. Under this phase, there will be special rules for vaccinated Australians and lockdowns are less likely. Quarantine caps will remain, but more vaccinated arrivals will be permitted. The Prime Minister says he hopes to enter this stage by the end of the year.
We're not going to set timetables on it. I would hope so, but that is entirely up to how the nation responds to this challenge we're setting for ourselves, each and to every one of us. And there will certainly be the supply and the distribution and the opportunity to do that. But whether that is achieved is up to all of us.
To trigger the third stage, Phase C, 80% of eligible adults must be vaccinated. There'll be no restrictions for those who've had both doses. Restrictions will only be limited to highly targeted lockdowns and for vulnerable communities.
Lockdowns are possible. The word, I forget the exact wording, but it says lockdowns are still possible. As we all know, lockdowns are really, until we're all vaccinated, the only thing that works. When we hit the 80% mark, lockdowns would only be for unusual circumstances in specific locations. But 80% vaccination is very high, but we still reserve the right to lockdown in specific locations if absolutely necessary.
No vaccination target has been decided for the final phase, but under this stage there'll be a gradual opening of international borders and coronavirus will be treated like any other infectious disease.
The scientific evidence shows that we're largely then in a place where COVID can be managed consistent with other infectious diseases. And of course we don't apply those types of restrictions to the flu or many other things like that.
Let's get more on this vaccine roadmap now with our data analyst, Casey Briggs. Casey, good evening. Can you put these targets into some context for us?
Yeah, hi Eliza. Well, first of all, let's just look at where we are at in the race to 70% of the eligible population for vaccines. So that's people aged 16 plus. 18.2% of people have 2 doses at the moment, so that's quite a way short of 70. Another 22% have a first dose. So within the next couple of months, you would expect that the second dose, the both dose rate would be at about 40%. So there's still 30% of Australians that we need to get in the front door, have a first vaccination, first dose appointment. But it's probably worth putting this into some context on an international and also looking at the modelling around what this says. 70% of Australians 16 plus, it's kind of roughly equivalent to about 56% of the Australian population when you include children. So Phase B is roughly 56% of Australia's population as a whole. And there are countries that have got a 56% population double dose vaccination rate already. This is from Our World in Data, some kind of back of the envelope calculations, but a lot of smaller countries, San Marino, Nauru, Jersey, Bahrain. We've got Israel is above that level, of course we know, Chile, the UAE, a fair few countries, and then a lot are quite close to it as well, the United Kingdom, Ireland, Portugal, Singapore and the like. So this is a target that other countries are getting to at this point. Many of them, of course, started their vaccination rollout earlier. They haven't had the sorts of supply issues that we've had, and they haven't had the same hesitancy around the AstraZeneca vaccine that we have had in Australia. The second question is, how big is that 56% target as a whole? Well, there's, or 70% of the eligible population. 2 pieces of modelling that came out just in the last 24 hours. One from the Grattan Institute did some modelling. They suggested 80% of the population would need to be vaccinated before, of the total population, including children, would need to be vaccinated before you could sever the link between health, between cases and really severe hospitalisation. So that's quite a bit higher than these 56 and kind of 64% for 80% targets that we're talking about. The Burnett Institute also put out some modelling this morning, looking at what the kind of consequences would you be looking at if you opened up at 70%. And they were saying, based on their modelling, that you'd likely need to see restrictions continuing for some time. Now, that was based on an assumption that the international borders would be considerably more open than I think the National Cabinet is canvassing. But that kind of puts us in a bit of context here. We're looking for 56%. It's achievable. It's probably not achievable in the next couple of months, but we can get there.
So you mentioned the time frame there. What is our current vaccination pace, and how soon can we get 70% double dosed?
Yes, at the moment it really depends on the state you're in as to how quickly things are going. Let me just show you, first of all, the national vaccination rate. We're looking at 210,000 doses were reported today, so that's a record. We've seen a fair few records in the last couple of weeks. This curve is climbing, and it's actually climbing quite steeply at the moment, and we can only presume, we can only hope that it will continue to grow as supply, particularly of the Pfizer vaccine, increases in the coming months. But those 210,000 doses, they're not evenly distributed across the country. 40% of them were in New South Wales, so New South Wales is now doing 63, 64 or more thousand doses a day on average at the moment, and that has been surging since that's when the lockdown began. June 26 or so. We've just seen this steady increase ever since then. The New South Wales government, the Premier Gladys Berejiklian, has made a vaccination blitz a really key part of the strategy at this point. So you would think that that would continue to increase. And if you see the first dose pace in New South Wales continue, here's the state-by-state breakdown. New South Wales has a first dose rate of 40.2%. 2.6 million people have a first dose at the moment. If the current rate continues, in about 7 or 8 weeks, you'd probably see this at 70. Add another 6 to 8 weeks or so on top of that to then get all of those people with first doses to get their second dose. You know, what's that? Let's do the maths on that. That's probably 12 to 15 or 15 weeks or so, let's say, from now on the current pace, which the trajectory is it's going up, so hopefully that gets pulled in. Problem is, most of the states, New South Wales and the ACT, have the highest per capita vaccination rate at the moment. Most states are not going very quickly at all compared to that. WA, for example, I had a quick look at, and I think it's, you know, not 7 or 8 weeks to get to a first dose rate of 70%. I think it's more like 18, 20 or more weeks at this current pace. I think it will speed up, or we know it will speed up, and we'll just keep kind of monitoring what that time frame looks like and how quickly it can come in. You know, it's not something that will be achieved in the next couple of months. It's something that's going to take a concerted effort.